All right, thanks, Dale. And now to a 6 Investigates, looking into a study with a $500,000 price tag, one that has left the Corpus Christi Nueces County Public Health District in a financial bind, and if not reimbursed, could affect the poorest in our community. Investigative reporter Brian Hoffman explains that study and why it was commissioned.
Well, Taylor, the $503,000 we're talking about was to pay for a study entitled Advancing Health Equity in Nueces County Amid and Beyond the COVID-19 Pandemic. It's basically a look at the overall health of the community as well as COVID-19's impact on each community. The study was commissioned in late 2020. How it came about and who even used this study are the big questions. Let's start at the beginning.
As the emergency manager, I went and petitioned upon the advice of council to the hospital district, because they're the ones that help deliver health care to the most vulnerable, that they should embark in the study.
And what is in dispute isn't who asked for the study, but who would end up paying for it in the long term.
Yeah, but we were told that we were going to be getting that money back.
I know.
What are you going to do about that?
It was clear that the county was going to work with the district to get reimbursement for this work.
During an emergency, like a hurricane, or of course in the pandemic, like COVID-19, county judges in Texas are the emergency managers. And with that title comes limited special powers. Those powers do not include promising county money without a majority approval from the Commissioner's Court. In 2021, Canales tried to get the Commissioner's Court to reimburse the hospital district, but was stopped by fellow commissioners.
Why would we be doing that when we as a court never authorized the hospital district to go do it? We didn't ask. Come to find out that the county judge allegedly went in and asked the hospital district to do this without authority by the Commissioner's Court. And now the hospital district is looking to the county to repay that based on the county judge's unauthorized representations.
Following that Commissioner's Court meeting in 2021, the hospital district attempted to recoup the money from FEMA. The county allowed the use of their consultant, Haggerty, to help with the application, which cost the district $30,000. But FEMA denied this request.
At this moment it's a denial, but we've been told through official channels that it's going to be rescinded.
And it was only to be met with a different denial. So where does that leave the hospital district? Barbara Canales signed these 2 contracts with the companies that worked on the study. The district has budgeted $75,000 to recoup these costs from FEMA. But if that fails, they've already put commissioners on notice. The hospital district will be asking the county to repay the money, so it will either be the hospital district and eventually indigent care that takes a hit, or the county and thus the taxpayers that will have to foot the bill if FEMA refuses yet again.
I feel really good that within the next 4 months, we'll be able to recover these dollars in whole or in part.
FEMA appeals are very, very difficult to win, almost impossible to win. And I understand they're going to reissue another letter under another clause that says we're still going to deny it. So, you know, the indigent people in this community are the ones who are going to suffer from this loss.
With a closer look into your tax dollars, Brian Hoffman, 6 Investigates.